Right. So sige, while you are sending your seat work, let us start with our chapter 46. This is our anti-cancer drugs. So I really need to discuss this with you kasi this is also a favorite topic when it comes to the board exam. And nowadays, we have oncology centers that also hire oncology pharmacists para mag-prepare sa mga anti-cancer drugs natin. So this one is actually one type of drug na kailangan talaga pagtuunan ng pansin, and that the dispensing, the storage, and the administration require additional na mga things that need to be considered. So I hope you are listening. Pa-admit si Sakro, wala rin kita sa iyo nga ni sulod. Wala kita sa iyo ni sulod. Wala ko i-admit dere so far. Sige, let's talk about cancer. Again, let's talk about cancer, class. When you say cancer, it is also called malignancies, and that these are cells that are paspas kaayong mag-grow. There is abnormal growth of the cells, and we have more than 100 types of cancers nowadays. So these are actually just cells, no? But then, kaya nga nag-activity tayo with the mitosis, and sinali ko na lang si meiosis para ma-refresh kayo. Yun yung problem. They are rapidly increasing, they are rapidly multiplying. Yun yung problema natin with cancer. So if you hear the word metastasis or I don't actually know how to pronounce this one. Metastasis. This one is a condition wherein the cancer will now spread from one part of the body to another part. Pag nag-metastasize na gani na siya, maingon na ang doctor na nag-metastasize na siya. For example, originally the cancer is breast cancer, tapos pag nag-metastasize na siya, pwede na siya mapunta sa lungs and other parts sa body. Yun yung pag-spread niya. Now, if you hear the word benign, that is actually just a lump or a tumor, but that is not necessarily cancerous. So there is the formation of a growth of something, a tumor or a lump, but again, hindi siya considered as cancerous. But if it is termed as malignant, that's the time it becomes cancer. Okay? It becomes cancerous. The tumor is cancerous. Pwede din mag-lead ang benign. Yeah, there are certain benign tumors or benign lumps that can be that can become cancerous over time. So that is the reason why the doctor will assess it, whether kailangan ba siyang i-surgery, kailangan bang may treatment na gagawin, and that to prevent it in becoming malignant. Okay? Pwede yun siya mangyari. Now, to diagnose cancer, we do biopsy. So, when the doctor performs this one, the doctor will just get a piece of tissue from the site and i-examine if there is the presence of the cancer cells. Again, we call it biopsy. Lahat ng benign na lump sa breast, ma'am, posible maging malignant kung hindi matreat. Not necessarily na all lumps sa breast can become malignant, pero there are some na benign siya nag-start, pero pwede siyang mauwi into malignant. So, pero hindi lahat ha. Especially us girls, before our menstruation, actually, there are times na we can feel a lump in our breast. That is actually normal. That is the reason why when you have your physical examination, included also in the things that they ask us is kung kanusa ang ato ang last na menstruation. Kasi if kapaon nila ato ang breast and then may mahawakan sila na lump, if ka na going to have your menstruation na, that will be normal. And then after the menstruation, mawawala din yan ang lump. Ang problema kung hindi siya nawala after your menstruation. Okay? Again, pag meron kang makapa sa breast mo, kung going to menstruation ka na, it's normal. And dapat maging normal lang siya pag after menstruation mo nawala siya. Pero pag hindi siya nawala, talagang meron kang lump sa breast mo. So you can have it checked kung whether it is benign only. Sabi ng doctor dito. Yeah, that is the reason why the doctor has to assess whether it's benign or malignant. And if it's benign, kailangan din i-assess kung they are going to conduct surgery or madala lang siya with other treatments that we have para maagapan and hindi siya mauwi into a malignant tumor. That's one problem with conducting biopsy. I know a lot of people who have lumps in the different parts of their body and underwent biopsy. And then after getting a piece of tissue from the area, parang nagiging aggressive ang mga cancer cells. So kaya yung iba, because of they are afraid that the cancer cells will become aggressive after biopsy, they don't really they opt to not undergo biopsy anymore. Mo na ilahang ginakahadlukan. Parehas ako ang teacher sa una, naa siya lump sa iyahang breast. And wala naman, wala naman siyang, syempre wala man din na feel, no, basta mga cancer, basta mga early stages, they don't really feel anything except that may makapa sila na lump. Now, gipasagdan lang to niya for how many years, and then katong medyo naan na siya ma-feel na pain gamay, gipa-doctor niya. And then the doctor advised na mag-biopsy. After biopsy, grabe ang pag-aggressive sa mga cancer cells after na wala siya naabtan og a year na namatay na dayon siya. So nagpaspas gyud. Ang una-una naglamp lang siya tong nag-biopsy na kanang nagtubig na, tapos nag-spread na, naglain na ang nawonggod sa iyahang breast after. So maulang na siya ang one disadvantage of the biopsy, but this is really a good test to determine whether the lump or the tumor is malignant or benign. Sa imuha pod mama alay, that's the problem with biopsy. I know a lot of stories na after biopsy the cancer cells become aggressive. So ano siya, hindi siya due to hormone isobel, naagyod siya makapa. Actually, I had that one also. I had this PE physical examination. I think that was 2 years ago na may nakapa din ang doctor sa breast ko. Pero gipangutan ako niya kung nag-menstruation na ba ko. So I told her na wala pa. And then the following year, nagpa-PE na pud ko. Wala naman siya. So that is siguro due to that kanang mag-menstruation na. Pero kung wala gyud siya nawala, pwede nga na kay lump gyud sa imuhang breast. So actually ang uban kay naalang gyud kanang mga former ana sa mga cyst. I think naaman siguro. Yeah, kasi dito lang naman sila nagpapabiopsy. Or dito kinukuha ang tissues or dinadala somewhere. Yeah, due to fats yung iba. Yung ibang lump sa breast due to fats and other parts of the body. Your father also has tin? Ano yun na cancer? Cancer yun? Nagpa-ultrasound asa? Breast pod nimo? Lung cancer in your father. That's a problem with lung cancer. It's very aggressive type of cancer. And di ba si Miriam Santiago maupod na yun, ikamatyan. And madali siya mag-metastasize. Ang sa iyo breast, okay. Mao na ilahang ginaingon magpa-ultrasound for kapag ka may makapa So, pwede po na ninyo siya buhatan just to see. Pero ang uban kasi fats manggod na siya. So, actually, I have my cousin na naapod siya lump sa breast and ang iyaha gani kay painful. Pero hindi siya cancerous. So, ang binigay sa doctor sa kanya is vitamin B plus vitamin E. Vitamin B plus vitamin E. So, naatay mga combination drug, preparations ana sa market. Naapod, pwede pod nga hiwalay nga tambal ay na tablet, pwede ninyo siya sabayon ng inom. That can actually help us kapag ka may mga pain or may mga lumps tayo sa breast. Vitamin E and vitamin B complex. Okay? Yeah, that's the problem with the biopsy. Mabilis mag-metastasize. Pag matandog man good siya, so siguro because, di ba, they will get a tissue, so matandog siya, and mag-result siya into maging more aggressive ang mga cancer cells. Now, what are the causes of cancer class? So it can be because of carcinogens. We will be exposed to chemicals that can cause cancer. So we have to identify, especially when we do laboratory experiments, most of our organic solvents are actually considered as carcinogenics, like our benzene. So that is the reason why you really need to protect yourselves. So you have to wear your proper protective or personal protective equipment, especially your mask, so as to limit the exposure to those chemical substances. And then others will be heredity. That is actually the number one factor, hereditary. Nasa genes kasi yan siya, class. Most likely if you have, especially if immediate family, mother or father, most likely ang genes mo din, nag-carry ka din ng genes for cancer. So just like si Angelina Jolie, diba? I think her mother had breast cancer, if I'm not mistaken. Thus, she also underwent testing whether yung genes niya, specific types of cells sa body niya present, yung parang cells na, yung gene ba or cells na makadetect na pwede ka rin magkaroon ng cancer. So since nakita sa testing na meron talaga siya na napasa talaga sa kanya yung genes na yon, that is the reason why na pinatanggal niya yung kanyang breast. Okay? Yeah, kanang mga batok na pagkaon makakause og cancer. Yes, belly, yung mga char, di ba we call it char, yung mga like mag-barbecue tayo tapos mag-itim na siya, or mag-toast tayo, mabatok mo ito, we call it char, and that is also considered carcinogenic. So yung mga taong mahilig magsugba-sugba, mga barbecue, unsa pa ng mga ginagrill din ha, yun yung mga people prone to, most of the time, it's stomach cancer. So that is because, again, of the char from the food. Carcinogen yan siya considered. Okay? And then, dyan na agoy notes. You can have your mga sinugba, pero ayaw po dalaw-adlaw ha. And then ayaw po ninyo kaunan ng nabatok na. Kaunan po dahil ninyo ng nabatok na. Okay? So please be mindful of that also. Let us protect ourselves. And then sa hereditary, we cannot do anything about that. Kasi kung nasa genes niya talaga yan. Actually, the father of my friend died, I think that was last month, due to brain tumor. He was diagnosed 2 months ago, and then after a month, namatay na siya. Pero the good thing daw, according to my classmate, is hindi nagsuffer ang kanyang father. So, walang yung pain, 'di ba? Basta cancer, it's very painful. Pero ang papa sa akong classmate, wala gyud siya naka-feel og pain. Napa-doctor na diagnose lang siya kasi ang ilahang nakita sa iyaha is mersyag nagdemensya nga, pirmi siya makalimot-limot, na since he was a tricycle driver, na naday one time na malengke siya. sa public market nato. Tapos nakalimot siya nga nagdala din siya tricycle. After niya na malengke kay nagbaktas na siya pauli. Tapos dito niya naalala nga nag-tricycle, nagdala din siya tricycle. Naan na siya sa siguro naan na siya sa may Joan's din ha sa Charon Boulevard ba na? I'm not sure unsa na nga ano, na street ka na may Mercury din ha, nagbaktas na siya pauli. So, kato, mo na ang nakita nila, murag nag-dementia siya, so gipa-doctor nila. And then, pag-check sa doctor, gipa-CT scan, ano na di ay, ako na kayang tumor, pag ano sa CT scan, dinhi ka nang, okay pa kay dinhi niya, almost half of this is puno na siya og tumor, pero wala siya na-feel na pain. Pero when he died, that was the only time na naka-feel siya og pain nga grabe na gid man na matanggal na gid iyang buhok kay iyang ginabira sa kasakit. That was just one night only, and then after pila ka hours na coma siya, and then at 7 a.m. in the morning namatay na siya. So mao to ana ako ang friend na the good thing lang daw is wala nag-suffer gyud og grabe ang iyahang father. So heredity, yan ang tanong ko sa iyahan, naagyud ba sa ilahang family? Naagyud sa ilahang family kasi ang mga igsoon sa iyang papa, yung mga tito, mga different kinds of cancer pod, not necessarily the brain tumor pero cancer pod, and then napod siya pag umangkon nga nag-leukemia, so kana sa ilahang genes, naagyud sa ilahang genes ang kaning cancer. Okay, and then aside from that, we also have viruses and other infections that can cause cancer. For example, for us girls, the human papilloma virus, the one that causes kalunggo, unsa ganina sa unsa ganina warts. By warts. We have two types of human papilloma virus, the 1 and the 2. The one that causes kalunggo from the other body parts is the HPV1. And then the one that causes sa genital na warts, it's the HPV2. And if magkaroon taana in our genitals, that can cause cancer sa atua, cervical cancer. Ano, pagtanawon nila dito sa may cervix, pag makakita daw na ang doctor og murag cauliflower na form na sa tissues dito sa cervix, that's an indication na the person might have a cervical cancer. Oh yeah, there are people na madali kung na-diagnose agad yung kanilang lump sa breast and then tinatanggal agad. That's a good thing also, kaya para hindi na siya maglala pa. So I know a lot of people also na some of them gani are just being operated in the emergency room, and then afterwards outpatient na after getting the lump sa breast uli na niya gipakita na koy kaila nga isa gipakita niya ang iyahang, pero gamay ra jud kay gitanggal lang jud ang lump sa sulod, pero kailangan man gud na siya i-check jud first sa doctor if that's just benign or malignant. If that's benign, dali ra kaayo ang surgery for that. You have cancer in your family, Tin? Daghan.
Oo, ma'am. Pero na-survive man nila, ma'am.
Okay. One thing that is for cancer is dapat early diagnosis siya. Our problem manggod kay wala manggod na sila gibati pag early stage pa lang. Dito na siya mostly daghan ang mga signs and symptoms pag terminal stage na. Pero kung early stage, actually the most treatable, one of the most treatable is the breast cancer. Daghan og survivor sa breast cancer actually. And then I also have a friend na survivor sa bone cancer. Pero siya, giputol ang iyahang tiil. The problem is, I think that was 7 years ago, nagkaroon siya og cancer, nag-chemotherapy, and then just 2 years ago or a year ago, 2 years ago, he was again diagnosed with lymphoma. That's another cancer na pod. Mao nang problema sa cancer good pag survivor na ka, dako pod ang chance na magkaroon og remission. Yeah, and then the remission will be in another part of the body. So nag-lymphoma siya, nag-chemotherapy na pod siya, and then actually nowadays he's actually okay. So nakauli na siya from the chemotherapy. Actually last year pa siya nakauli. Diyan daw, potato patch. Nanapod ng cabbage. Ng cabbage. If actually that is true, no, daghan unta og naayo kung ingana lang man di ay. Pero I don't really believe her. Sorry. Kanang kay Dr. Farah, I don't really believe her. I mean, I believe in the power of our nature, no? Kasi most of our drugs are coming from our plants man yun. Pero in her case man good, it's I find it more of a business than really actually caring for the patient. So kana ang iyang mga ginatudlo pero di ba daghan siya og products, and actually those are expensive products. So I don't really believe her, more on the business side na siya. And then smoking and tobacco. So we know this very well. Smoking and tobacco, like sa lung cancer or sa mouth cancer. Sa daw gikapa lang niya ang breast sa isa ka patient mo. So na siya si ito Korean drama nga iana lang niya iyang kamot niya makapalo na siya sa ito si Lee Jong-suk siya na power sa kung ingana lang man di ay no kay ano mag-eskwela pamantaan ning daghan kay itong subject, may mga biochem, mag pre-med, tapos pagkahuman mag proper pa nga med course. Tapos kapaon lang day. I think Dr. Stranger to siya. Madyada. Okay, diet and physical activities also. So, sa diet pod nato class, pwede pod nato makuha atong mga carcinogenic na mga substances din ha. And especially if we will have malnutrition also, so be careful sa inyong mga ginakaon. And physical activities, so included gihapon ang regular exercise for that, para dili ta magkaroon og taas or dako nga risk for cancer. Basta galing siya sa North Korea. Sila matic biopsy. Matic biopsy yung kamot. Ano yung nindot kasi non-invasive. Biopsy kasi is invasive. They will really get a tissue, a sample tissue from the area. While kung kamot lang man day iyang gamit, that is non-invasive. Basig mo na siya nindot kay dili maging aggressive ang cancer after. Maka-reduce daw ng blood sugar yung foot massage. Actually okay ra kaayo mag foot massage, that can be beneficial for us also, but kung kana lang imuhang himuon, I don't think that will be effective. So okay, kaning mga massage, that is actually good for us. Pero dili po na siya adlaw-adlawon ha, kasi I know someone adlaw-adlaw nagpa-massage and then after that nagkaroon siya cancer sa muscles. So panagsa pang unwind para ma-relax, ma-release ang stress. May device. Mo na ako ang ginaingon na I find it more of a business than actually caring for her patient. And then, syempre, radiation. So, be careful on the exposure for the radiation, ha? Kasi this can also cause cancer. You know that very well. And then, these are the examples of the viruses that can also cause cancer. Hepatitis B and C, syempre, can cause liver cancer. And then, we have HIV, the human immunodeficiency virus can actually lead to Hodgkin's and non-Hodgkin's lymphoma. I will discuss what lymphoma is later, but itong Hodgkin's and non-Hodgkin's, there is just a specific cell type that is present in Hodgkin's and that is not present in non-Hodgkin's lymphoma. So, pag makita ng doctor, it's a lymphoma, kailangan lang nilang hanapin yung specific type of cell if present pa siya or hindi. Pag present, Hodgkin's. Pag hindi, non-Hodgkin's, and from there, they will determine also the specific chemotherapy drug na effective for the different types of lymphoma. And then we have the HPV. I have mentioned this a while ago. The human papilloma virus can cause cervical cancer. And then the Epstein-Barr virus, this is the one that is also called as kissing mononucleosis, because this virus can be transmitted through the saliva. Mao na gitawag siya kissing mononucleosis. Literally, if a person is infected with this virus and syempre nag-share mong saliva, then you can get this virus also. So, manang gitawag siya kissing mononucleosis. Actually, this virus is also very common in Southeast Asian countries. And in our lives, actually, once in our lives, we are actually infected with this Epstein-Barr virus. Pero ang kanyang, ano lang manggod, ang kanyang signs and symptoms, parehas lang with like, you have flu, kasi you have fever, you have swollen lymph nodes, masakit imong ulo, kanang lain imong paminaw. So most of us adults, kapag we are infected with this type of virus, we can actually recover after 2 to 4 weeks. Some will just have fatigue. Kapoy kaayo ang feeling, lain ang paminaw. Pero if our immune system is really okay, then again, we can recover from the infection. Pero our problem with Epstein-Barr virus, if your immune system is not really okay, it might infect your nasopharyngeal part of the nose sa likod, and it can trigger cancer. Okay? No to no to sharing of saliva. Safe kayo. This is actually a board exam question. O ano daw yung virus which is called kissing mononucleosis. Pero not just with saliva, ha. You can also transmit this through the semen, through the sexual intercourse, and the blood transfusion. Pero it's more of the kissing mononucleosis. So, safe ta sa mga wala naka-share. So, wala ka-share. Muna ko ang ginaingon class na if you go into relationship and before you go into sexual things, sexual activities, requires na sila og full physical examination. Complete physical examination. Basig na ay matransfer from the different parts of their bodies sa imuha. Okay? Alagay flashlight. Kasi most of the time we do sexual activities sa dulom. So kailangan na kay dala nga bala. Dapat flashlight kay iwagan man na nimo. Pag naagani kay makita nga samad in the genitals, abort mission. So abort mission yun na siya kay it's not really common na you can see mga unsa mga samad or mga unsa dinha sa genitals. So pwede na siya sexually transmitted infection or disease. Okay, now we have here general signs and symptoms of cancer. So daw, bless gets mo naman siguro yung flashlight na pinag-uusapan na si Blessil. Blessil? Nagkasinabot tayo.
Ma'am, nakadungog ako mama, nagkatawa.
Okay, pag-iingnan ka ni Majeda, gets mo naman siguro yung flashlight na pinag-uusapan, Blessil. Kung ba, anong ginatira niya si Blessil? Pero actually, though it is a joke, pero sa mga ingana man good nga butang, you really have to protect yourselves. Labi na pag ang example ang lalaki. Pero I'm not really saying na lalaki lang, kay naman po yung mga babae, no? Na po yung mga lalaki nga sobra pud ka, how do we call them?
Ma'am, last time manggod wala ka get si Bless og say flashlight nga ginamin.
Wala siya ka-get sa flashlight. Karon bless you, nakagets naman ka, no? Anyway, again, mga lalaki, for example, na, how do we call them? Adarit, na chikstirada. So, I don't really trust them kasi basin na sila yung mga ginadala ng mga whatever. So, will require them complete physical examination before entering to those things, ha. So muna siya class nga ay mo patakagdas magha basig makauyab, basta makauyab bisag kinsa na lang, and then wala ta kabalo kinsa na inyong nauyab binhan darit kayo. Basig nanay dala Epstein-Barr virus or the human papilloma virus or HIV or hepatitis, whatever. Unsa daw before ta maguya before ta maguya magpa-test ta sa mukha. Kasali sa dowry namin ang isali na siya madyada medical history sa una wala na siya ginasali, karon isali na siya sa mukha. I-appeal na siya. That just to be sure. Okay. Anyway, general signs and symptoms of cancer. General ha, general. Kasi there are specific symptoms. Depende na siya kung what part of the body has cancer. But in general, people with cancer might have unexplained weight loss. So, bisag wala naga-diet, mukalit og payat. So, muna, permi na ko ginaingon sa inyong haklas. Pag ingon ko ninyong namayat ko, moingon jud kog nag-diet ko. Pag namayat ko, ingon jud ko nga nag-diet ko kasi if wala akong ginawa, hindi ako nag-diet, hindi ako nag-exercise, and biglang pumayat, that will be called unexplained weight loss. And that is not good. It means that there is something wrong in your body. So it might be diabetes, just like our discussion last time. Di ba, people with diabetes will also have unexplained weight loss, or the person might have cancer. That is the reason why nagpayat o kalit. Okay? So, mo na siya class nga, matingalag yun mo, og nikalit mo payat, and then, wala man mo nag-diet. Okay? And then, we have fever. Di ba, remember, we have the naproxen test for this. If, for example, nag-fever, unya, ala, balik-balik na fever, or diretso-diretso na fever, and then hindi siya mag-subside even if you take paracetamol, aspirin, or other antipyretics that we have. And then if you use or you take naproxen, and then bigla siyang nag-subside yung fever, it's actually a preliminary test for cancer. Again, we call it naproxen test. And then we have fatigue, kapoy lang pirmi. There is pain also, like any part of the body, and paulit-ulit mo siyang nafe-feel na pain. And then skin changes. For example, you have moles, alom ninyo nga mukalit og dako or mukalit og lahi iyahang color, or any part of the body or the skin na mukalit og lahi ang iyahang color might be also a sign that there is really something wrong. It might be cancer. And then change in bowel habits and bladder functions. So example, kalit na lang ka, mag-diarrhea lang kang kalit, and then afterwards mag-constipation na pud ka. So it can be an irritable bowel syndrome, but that is also a general sign of cancer. And if, for example, you have sores that do not heal, hindi siya nag-heal talaga, so pwede ra pud na siya diabetes or pwede pod cancer. Okay? May dugo sa stool, that is also one indication, but you actually have to assess the blood in the stool kasi kapag it's color black na, meaning the bleeding is really on the stomach or in the intestine, murag napanos na gud ang dugo. Pero if it's really fresh blood, naara na something wrong ana is naara sa imuhang anus dapit. Okay? Pero it's not necessarily cancer. Kasi example, yung patients with ulcer, since naa sila ulcerations no sa stomach, pwede man pud gud na mag-bleed. So natay mga ulcer patients na they also have blood in their stools, and then sa fresh blood pod kay sa mga people with Almoranas class, 'di ba? Magdugo pod na ang ilahang so fresh blood pod to. So again, it's not necessarily cancer. So that is why we really have to have a correct diagnosis so that we know what to do kung naatay mga signs and symptoms na mention. Okay? And then we have white patches inside the mouth or white spots in tongue. That is actually for smokers, and that's a sign of having cancer due to smoking and use of tobacco. And then unusual bleeding or discharge. So for us girls, syempre we have the menstruation, but yung iba kasi even if they don't have menstruation or even if they are nag-ano na sila, menopause na sila, kadjot kinayo kayo. Kadjot lang, wait lang 5 minutes. Okay, sorry sa interruption. Basta nagka-klase ka sa balay, wala na mag-ayo. Okay. Kinsa man na si Jalami? Kinsa pa ni sulod bago lang? Jalami Napoles.
Rosel, ma'am.
Rosel na ma'am.
Sige, lahat daw ng tao may cancer cells, matrigger lang daw sa... Yeah, actually that is also true. We also have cancer cells, but ang sa iba, ayan, murabag ka ng murag natulog ra, and then ang uban ka ng ma-awake lang good. So, ang uban, pag ma-awake na, it becomes aggressive. So, ang uban paspas pag kayo ang pagkalat. Okay? So, asa na ta? Unusual bleeding or discharge, no? And then thickening or lumps in the body is also one indication. Recent change in warts or moles. So, if you have like your moles class, labi na basta ka ng growing good ang imuhang moles. So, you have to really keep track of that. Sa mo change ang iyang color, sa mo palit lang siya dako. And then we have nagging cough or hoarseness. Okay? Sige ubo. Okay? Questions about the general signs and symptoms of cancer? Ang sa hoarseness, permi pagaw. May mga tao nga permi pagaw, and then later on makita na lang din na they really have problem diri na part. Wala pangutana. So let us 10:30 na di. So next meeting class, we will be continuing our discussion sa different classifications of cancer. So isa-isahon natin na sila ha: carcinoma, melanoma, lymphoma, leukemia, and sarcoma. And then after that, magdi-discuss na tayo ng chemotherapy. So isa-isahon pod natin na sila from the what's the first one? Anti-metabolites hangtod sa pinaka last one. Questions so far before tayo mag-end? Ano kabantay sa oras 10:28 na di ay?